Hi, I'm Chris. I did work in A shift today. I will be reporting on our patients in bed 19 and then bed 22. I'll start off with bed 22. 38-year-old male. He presented to the ED with seizures. He was in AFib RVR with EMS. A seizure was witnessed this morning times 2, lasting about 1 to 2 minutes by his wife. The patient is ANO times 3. He is here with his wife and daughter. However, they did go down to the calf to get something to eat, so they will be right back. Medical history revealed history of seizures. He's non-compliant. His last seizure was about 4 months ago. The patient's main medical diagnosis is tonic-clonic seizures. He is at risk for injury related to altered consciousness and body awareness. Secondary to the seizures, as evidenced by, we did have to put him on medical restraints for safety. His lab results are as follows. His lactic acid was elevated at 13.4. His pH was low at 7.18. His CO2 was also elevated at 51. And his PO2 was also low at 59. He did test positive for alcohol when he did come in. His ETOH level was at 0.05, and his blood sugar also was high at 144. His treatment plan did include a CT brain and chest. We also did administer Keppra, phenobarbital, LR, Ativan, and metoprolol for his pulse. Throughout my shift, his pulse was pretty high, and it stayed pretty high and steady, so doctor did prescribe him metoprolol. It did go down and it did improve, so which was great. It was in the 140s, and then it actually went down to 100s, so that's great. He also was on 15 liters of oxygen through a non-rebreather mask just to keep the airway patent, and then also again the medical restraints just for safety. He does still have medical restraints on him, but we just want to keep it on him just so that he doesn't have another seizure activity. Great news. So the CT in the brain came back negative. His pulse improved. We did put him on a nasal cannula now because he did convert back to normal sinus rhythm. He is going to be transferred to the medical surgical floor for continued observation. However, we are just waiting for a bed, so I'm just waiting for them to call me. And then for our patient in bed 19, she's a 68-year-old female, sweet lady. She did come in for a fall and hip pain though. She is ANO times 4. She fell at the villas and then she heard a pop in her left hip. Medical history revealed she has history of arthritis, gout, hypertension, left femur fracture. She did have a left hip replacement, and she also has a history of substance abuse. Her pain was 8 out of 10 when she came in. Doctor actually sedated her, put her on 100 micrograms of fentanyl, and doctor was able to put her hip back into place. We did order an x-ray, which did show a successful placement. Doctor also ordered a UDS, also because it's her history of her history of substance abuse, just in case that she needs to go back into surgery. They just want to make sure she's cleared for that. She is ready to be discharged from the hospital. However, we do want to make sure the sedation wears off before letting her go. And I think those are it for the 2 patients. Do you have any questions for me? Thank you.